Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Question 1. Tilozolin. Tilozolin is used in. Tilozolin is a vasodilator which is used before cardiac catheterization. For vasoconstriction, the drug which is used as a vasoconstrictor in treatment of varices is actually propanolol is used as a vasoconstrictor for the treatment of varices. Myasthenia gravis. The drugs which aggravate myasthenia gravis are aminoglycosides, tetracycline and phenytoin will aggravate myasthenia gravis. Azathioprine does not aggravate myasthenia gravis. Modafinil. Modafinil is used as an adjunct for which of the following? Modafinil is used as an adjunct for obstructive sleep apnea. Then intrinsic activity is present in. Intrinsic activity is present in Pindalol has intrinsic activity. Used in detrusor instability. The drugs used in detrusor instability are solifenacin, tolteridone and trospium is used in the detrusor instability. Drugs used in the treatment of pulmonary hypertension are in the pulmonary hypertension digoxin, amlodipine and furosemide can be used, but beta blockers are not used in pulmonary hypertension. Drugs used to treat erectile dysfunction are we can use papaverine, sildenafil and apomorphine can be used for erectile dysfunction, but phenylephrine is not used for erectile dysfunction. Clonidine. Clonidine will result in dry mouth and it will inhibit the sympathetic outflow, and it is an adrenergic agonist, especially it is alpha 2 agonists. Prazosin does not antagonize it because prazosin is an alpha 1 blocker, whereas clonidine is alpha 2 agonist, so prazosin does not antagonize the clonidine. Drugs used to perform the stress echocardiography is by dobutamine. The drug which is used in erectile dysfunction are erectile dysfunction in the options apomorphine, vardenafil and yohimbine is given along with phenylephrine. Phenylephrine is not used for erectile dysfunction. Apomorphine, vardenafil and yohimbine can be used. Hyperatropium bromide. Hyperatropium bromide is contraindicated in. Hyperatropium bromide is contraindicated in urinary retention because it itself causes urinary retention. Hyperatropium bromide is used in the treatment of asthma or COPD. We can use it. Then pralidoxim. Pralidoxim is actually an cholinesterase reactivator which is used in organophosphorus poisoning. Tiotropium. Tiotropium is used in the treatment of which of the following? Tiotropium is used in the treatment of asthma and COPD. Then all of the following are used in relieving post-operative spasm, except post-operative spasm can be relieved by anticholinergic agents like darifenacin, tolteridone and hyperatropium. The other option which is given is bethanacol. Bethanacol is a cholinergic agent, thus it does not relieve the post-operative spasm. Whereas dorifenacin, tolteridone and hyperatropium will relieve the post-operative spasm. Next question. Ergotamine is contraindicated in the options. Ergotamine is contraindicated in. Options are pregnancy, vascular headache, then ischemic heart disease and erythromycin. Um, Ergotamine is contraindicated in pregnancy, ischemic heart disease, and also patient on erythromycin. It is not contraindicated in vascular headache, and actually it is used in the treatment of migraine. Migraine is a vascular headache. It is used in the treatment. It is not contraindicated. Question. Therapeutic actions of beta receptor blockers, that is therapeutic actions of beta blockers in angina, are primarily results in which of the following? Okay, beta blockers will actually decrease the heart inotropic effect, and thus that is it decreases the force of contraction, thus decreasing the myocardial oxygen demand. Then question. Hypotension, bradycardia, respiratory depression, muscle weakness. All these are unresponsive to atropine and neostigmine, would likely be due to. So the patient has lower BP, hypotension, bradycardia and respiratory depression with muscle weakness, but they show no response to atropine or neostigmine. Atropine is an anticholinergic agent, whereas neostigmine is acetylcholinesterase inhibitor. So atropine will decrease the acetylcholine, whereas neostigmine increases the acetylcholine. Both these are not working. So it is definitely not related to muscarinic receptors. So this is something which is related to nicotinic receptors. So the answer here is nicotine will cause hypotension, bradycardia with respiratory depression, which is unresponsive to atropine and neostigmine. Which of the following side effects should be kept in mind before prescribing propanolol to a susceptible patient? Before prescribing propanolol to a susceptible patient, which of the following should be kept in mind? So always for propanolol, propanolol is contraindicated in bronchial asthma and also hypoglycemia, because it can mask the symptoms of hypoglycemia, so in diabetes mellitus. So while you give propanolol, you should always think of bronchial asthma and diabetes mellitus or peripheral vascular diseases where propanolol is contraindicated. Question. Which of the following statements is sotalol? Sotalol, first statement, it is non-selective beta blocker. Yes, sotalol is a non-selective beta blocker. It prolongs the action potential duration throughout the heart. True. It is a polymorphic ventricular tachycardia is a side effect. Polymorphic ventricular tachycardia is a common side effect. True. It does not have hepatic metabolism. It does not have hepatic metabolism. So these three are the true statements. Question. Reserpine will inhibit the release of granules in the nerves. Reserpine inhibits the release of granules at the nerve terminal. Alpha plus beta blocker is labetalol is an alpha plus beta blocker. Question. Hyperatropium bromide. Hyperatropium bromide is mainly used by inhalation and scratching the trachea. It also causes dryness of mouth.
Thank you and thank you for watching.